Great. I'm Heather MacLeod from the Government Accountability Office, and I've been involved in a number of studies at GAO, particularly over the last six or 7 years, where we've done a series of studies looking at transportation disadvantaged populations. And these have all been at a congressional request, and our work has kind of evolved along the lines of what we've been talking about this morning. Initially, we got a couple of requests from congressional committees for us to look at coordination. And particularly, we are, as the Government Accountability Office, we're looking at the federal role. And so we were looking at the FTA under this committee's jurisdiction and their role in coordination and some of the things that are going on in transportation for disadvantaged populations. And that evolved into, while we were doing our work, all these issues of non-emergency medical transportation came up, which led to a separate request asking us to look at non-emergency medical transportation. So through the course of our work, initially we identified 80 federal programs that provide transportation services to transportation disadvantaged populations. Outside of the FTA and a small number of other federal programs, the agencies were unable to identify their programs that provided these services, and they weren't able to provide any funding information. And so we were left with 80 federal programs, and we don't know how much money, and we're not even sure these are the right programs or the right number of programs, because when we went to the federal agencies, they couldn't tell us. So we had to come up with this ourselves. So that was kind of a source of an issue that has carried through our work. On the non-emergency medical transportation area, we found 42 federal programs that provide these services. Again, with the FTA being able to identify their programs and funding, but other federal agencies just really not having that type of information available. After these initial studies, we were asked to do work on the healthcare side, which I'm sure was probably a relief to the FTA, because we've been knocking on their door for several years in a row and making recommendations, knowing that they're asking them to be the ones to bring these groups together. And so asking us to look at the healthcare side of things was a little bit of a different angle for us at GAO, and we were able to work among our transportation and our health experts within the GAO to get behind those issues and really look at them from the CMS, from the HHS perspective, and subsequently make recommendations to HHS instead of the FTA. So I think what we've heard this morning is kind of the evolution of bringing these healthcare and transportation issues together. And I think what I could say is I think the congressional committees are tracking with that as well, and we've seen that in our work. And we continue to bring work together on this, on bringing those issues together.